Men, let's get honest for a moment. Imagine still dealing with urine dribble or that nagging feeling of not emptying your bladder completely, not just now, but months or years from today. Imagine your erections fading, your confidence slipping away, and that silent frustration showing up in your daily life. At the gym, in the bedroom, at work. These issues don't just affect your body. They affect your sense of identity as a man. And many men, maybe even you, have tried everything just to feel normal again. But here's the truth. Aiming for normal often isn't enough. The solution starts with the pelvic floor. Your pelvic floor muscles form the foundation of control and vitality. They support the bladder and bowel, they stabilize your core, and they play a crucial role in blood flow and erections. When they weaken or become too tight, you get dribble, urgency, weak erections, or tension that you can't shake. The good news? You can retrain them. And when you do, the results are powerful. Better bladder control, stronger erections, calmer nerves, and renewed confidence. Today, I'm going to show you 3 of the most effective pelvic floor exercises for men. I'll also explain the science behind them, how to avoid the common mistakes, and how to build them into a daily plan. Then, at the end, I'll share with you something I call the daily renewal routine. A simple set of habits that amplify the benefits of these exercises and set you up for lasting vitality. Why this works. Pelvic floor training isn't just a trendy concept, it's proven. Studies show men who consistently train these muscles improve both urinary control and sexual performance. Here's why. Stronger pelvic floor muscles improve blood circulation in the pelvis, which is essential for erections. They also act like a switchboard for bladder control, helping you start and stop flow cleanly. And just as important, when you learn to relax these muscles, you release the tension that often causes dribble, urgency, and premature ejaculation. Strength and relaxation. That's the key. Exercise. 1. The pelvic floor. Flick. Think of this as your reset button. Lie on your back with your knees bent and feet flat. Place 2 fingers gently on the perineum, the skin between your scrotum and anus. Place your other hand on your stomach so you can check if you're accidentally tensing your abs. Close your eyes. Take a slow breath in, then exhale fully. At the very end of your breath, gently draw up and in, as though you are stopping the flow of urine. Feel the lift under your fingers. That's the pelvic floor activating. Now flick it off. Relax completely. On, off, relax, let go. Do 10 flicks in the morning, 10 at midday, 10 before bed, 30 a day. Enough to reawaken the muscles without pushing them into fatigue. Progression matters. Start lying down, then graduate to sitting, then standing. Finally, add it into movement, like walking. Each stage retrains your pelvic floor to work the way it should, automatically, without you even thinking about it. Common mistakes with flicks. Don't clench your abs, thighs, or buttocks. Keep everything else soft. Don't hold your breath. Breathe through it. And don't overtrain. More is not better. Precision is better. Exercise. 2. The tennis ball release. A strong muscle that cannot relax is not healthy. That's why release work is essential. Sit on a firm chair. Place a tennis ball under one glute. Cross your ankle over the opposite knee and lean into the ball. Let it press into the muscle. Breathe. Hold for 30 seconds. Then switch sides. Now, the advanced version. Place the ball on the chair and gently lower your perineum onto it. Let your arms support you as you control the pressure. It should feel like deep pressure, uncomfortable, but never sharp pain. Hold for 30 seconds, then release. This work helps unwind years of built-up tension from sitting too long, heavy lifting, or stress. Do it 3 or 4 times per week. You'll notice your contractions feel easier and more effective when the tension is gone. Exercise 3. the happy baby stretch. Now, let's stretch and lengthen. Lie on your back. Lift your knees, grab the outside of your feet with your hands, and spread your knees wide. Breathe deeply. Relax into the position. Once comfortable, gently pull your feet down toward the floor while keeping your knees wide. Feel the opening in your groin and pelvic floor. Hold for 40 seconds, then rest. Repeat once more. This stretch is perfect before bed. It calms your nervous system, opens your hips, and lets your pelvic floor fully release. Putting it all together. Here's your plan. Morning, 10 pelvic floor flicks. Midday, 10 more flicks. Night, 10 flicks, plus the happy baby stretch for 2 rounds of 40 seconds, 3 to 4 times a week. Tennis ball release. Simple, consistent, effective. Lifestyle factors. Your pelvic floor doesn't work alone. It responds to how you live. Extra weight increases strain. Stress and poor posture create tightness. Lack of sleep reduces recovery. Too much alcohol or caffeine irritates your bladder. Better nutrition, hydration, quality sleep, daily walking, and stress management all amplify the effects of this training. The exercises are powerful, but they work best when supported by good habits. A vision for your progress. Now imagine this: walking through your day without worrying about leakage or dribble. Laughing, coughing, sneezing without fear. Waking up with stronger morning erections. Moving through a workout without pelvic pressure. Walking into the bedroom with quiet confidence, knowing your body will respond. That is the future waiting for you if you stay consistent. Every flick, every stretch, every release brings you closer to that version of yourself. The daily renewal routine. Before we finish, I want to give you something extra. I call it the daily renewal routine. It's a simple set of habits that complement the pelvic floor training and create lasting vitality. Here it is. First, start your morning with 5 deep, slow breaths, in through the nose, out through the mouth. This primes your nervous system for balance. Second, drink a tall glass of water before coffee. Hydration supports both bladder and erections. Third, move your body every day. Even a 10-minute walk boosts circulation and reduces pelvic tension. Fourth, stretch your hips before bed. It takes 2 minutes and helps your pelvic floor recover. These small habits create a foundation. They don't take much time, but when stacked with your pelvic floor exercises, they transform your results. Men, you do not have to live with dribble, weak erections, or fading energy. Start with these exercises. Support them with the daily renewal routine, and stay consistent. I'm Dr. Fiona Grey. Thank you for watching. Stay committed, and I'll see you in the next video.